Every day you choose to move, your body responds with strength, balance, and renewed life. Each gentle motion is a gift to yourself, calm, mindful, and full of vitality. Together we move, we heal, and we thrive. Keep the rhythm of your golden years. Nurture health, cherish every movement. A thorough examination of functional fitness for longevity highlights that particular physical abilities, rather than ambiguous or broad exercise, are crucial for maintaining independence and quality of life in later years. Individuals over 65 years of age who experience a single fall resulting in a hip or femur fracture may initiate a series of medical and functional repercussions: acute hospitalization, surgical intervention, extended immobility, medical problems such as infection, thrombosis, and delirium, and a decline in independence. Epidemiological studies reveal a one-year mortality rate ranging from approximately 15 to 30% subsequent to such an incident. Among survivors, nearly 50% do not restore their previous level of physical function. This decline frequently results in diminished mobility, reduced capacity to execute activities of daily living, ADLs, increased dependence on caretakers or assisted living, and a significant loss of autonomy. These pronounced effects redirect the attention of doctors, researchers, and individuals from just prolonging lifespan to augmenting health span. The duration of life characterized by maintained functionality, reduced chronic illness burden, and absence of debilitating disorders. Notable figures in the longevity and preventive medicine sectors, including Dr. Peter Attia, have delineated a pragmatic framework for this transition. Attia contends that the nature of physical training undertaken during midlife and later significantly influences an individual's ability to maintain activity and independence during the marginal decade, the last 10 years of life, when physiological reserves generally diminish and functional limitations become increasingly evident. For many, that decade is characterized by advancing fragility, limited engagement in preferred activities, and heightened dependence. This trajectory is not fixed. A methodical and consistent conditioning approach focused on the abilities most pertinent to daily life can significantly transform the experience of that marginal decade, converting it from a phase of unavoidable decline into one of sustained participation and meaningful involvement. This tailored method is centered on 5 essential movement capacities. They provide a cohesive, mutually supportive array of skills that collectively establish a reservoir of strength, stability, endurance, and reactivity capable of counteracting numerous age-related alterations. Through the systematic cultivation of these competencies, individuals develop a robust physical foundation capable of addressing the typical demands of daily life, navigating stairs, recovering from sudden trips, transporting groceries, lifting grandchildren, and maintaining equilibrium on uneven surfaces well into advanced age. The subsequent analysis delves into each of these 5 critical components, elucidates the scientific and practical justification for their prioritization, and presents tangible, scalable techniques for their safe and effective training. 1. Eccentric strength, the deceleration mechanism. Eccentric strength might be regarded as the body's deceleration mechanism. In muscular physiology, an eccentric contraction transpires when a muscle actively elongates while subjected to strain. Common instances encompass the deliberate descent of the body while sitting, the quadriceps managing the descent on stairs, or the calf muscles mitigating impact upon footfall during ambulation. This braking action is crucial for deceleration force dissipation and control maintenance throughout various common actions. Deficient eccentric strength typically directly contributes to instability and increases the risk of falls due to its role in controlling motion and absorbing load. Dr. Attia's family excursion to Bali featured whitewater rafting and necessitated a descent of around 100 meters of steps to reach the river. Many might presume that the descent largely evaluates cardiovascular fitness. Nevertheless, the actual limiting factor was the capacity to regulate descent, chiefly the eccentric power of the quadriceps. As each step descended, the anterior thigh muscles elongated under tension to regulate movement against gravitational force. Insufficient eccentric capacity renders descending numerous steps exhausting, perilous, and demoralizing. The inability to execute a controlled descent hindered participation and diminished quality of life options. Comparable real-world instances encompass traversing inclined sidewalks, managing the fall from a curb while transporting groceries, or carefully lowering oneself onto a low toilet or theater seat. These are standard procedures, however they may be restrictive if eccentric control is inadequate. Physiology and aging sarcopenia. The age-associated decline in skeletal muscle mass diminishes absolute force output. However, the reduction in eccentric strength may be disproportionately significant and functionally more impactful. Eccentric contractions provide greater forces with reduced metabolic expenditure and are crucial for impact absorption and speed regulation. Aging and inactivity result in alterations to neural drive to muscles and tendon stiffness. There is a loss in rapid motor units, and the capacity for precise eccentric control reduces. Tendon compliance may augment in some conditions, diminishing force transfer and hindering regulated deceleration. Individuals with inadequate eccentric control may exhibit behaviors such as abruptly sitting in chairs, shuffling downhill, or circumventing stairs, and inclines short-term adaptation tactics that elevate long-term danger by diminishing the necessary exposure to sustain skill and strength. The principles of training indicate that eccentric strength is readily developed and benefits significantly from concentrated practice that prioritizes the controlled and deliberate lowering phase of movements. Fundamental principles encompass: highlight tempo, deliberately extend the descending phase, e.g. 3-5 seconds to augment time under tension and enhance motor control. Prioritize movement quality and control over mere load or volume. Eccentric exercises are neurologically taxing and benefit from deliberate repetition. Advance incrementally, commence with little elevations, and support escalating difficulty as proficiency enhances. Unregulated or excessive eccentric loads in the initial stages heightens pain and the risk of damage. Emphasize single-leg variations to simulate prevalent unilateral demands, stairs-curb negotiation, and to detect and address disparities. Employ regular brief sessions to establish neuromuscular patterns without inducing undue fatigue. Consistency is superior than volume for retraining eccentric control. Scalable practical exercises. Tempo squats, descend hips over 3-5 seconds to a bench, or chair pause momentarily and ascend at a standard pace. Commence with a bench height that facilitates control. Thereafter, advance to lower heights and finally to deeper ranges. Step-downs, position oneself on a low platform, transfer weight to one leg, and gradually descend the opposite heel towards the floor in a controlled manner. Elevate step height, reduce tempo, or eliminate hand assistance as acceptable. Negative calf raises from the apex of a step, elevate with both feet, then gradually descend one heel below the step level over several seconds. This isolates eccentric loading of the calf-Achilles complex and enhances landing control. Controlled sit-to-stand with an eccentric emphasis during alternating repetitions. Rise at a normal pace, but descend to a seated position extremely slowly to facilitate controlled lowering. This maintains concentric capacity while emphasizing eccentric control. Regulated descent from a step, descend a staircase, intentionally shortening stride length and managing each step with minimal hand contact until capable of navigating without handrails. Exercise recommendations: 2 to 3 sets of 6 to 12 regulated repetitions for each exercise, performed 2 to 3 times weekly at the outset. For unilateral exercises, decrease repetitions, e.g., 6 to 8 per limb. Advancement by enhanced range, reduced speed, elevated step height, or diminished support. Standard adaptation timelines, enhanced motor control within weeks. Quantifiable strength gains in 6 to 12 weeks when coupled with intermittent loading modifications. Anticipate initial muscular discomfort DOMS due to increased eccentric focus. Prepare accordingly. 2. Concentric strength, the engine. Concentric strength serves as the body's engine. A concentric contraction transpires when a muscle shortens while producing force, as seen in actions such as rising from a chair, ascending stairs, lifting objects, or pushing. Concentric strength enables an individual to counteract gravity and external forces. It is fundamental to numerous instrumental activities of daily living ADLs. Eccentric strength regulates controlled descent, whereas concentric strength facilitates upward or outward movement and the dynamic elements of locomotion and object manipulation. Practical illustration. Following rafting. The ascent of the 100-meter staircase evaluated concentric capacity, as each step necessitated successive shortening contractions of the quadriceps and gluteal muscles to elevate the body against gravitational force. The continuous demand also strained muscular endurance as numerous successive contractions were required. The deficiency of concentric strength impairs the capacity to execute everyday tasks, such as transporting groceries from the vehicle to the kitchen, lifting grandkids, or standing up from a low sofa or the floor after a fall, gradually restricting safe activities and necessitating a transition from active participation to passive observation. Physiology and aging. Advancing age diminishes maximal force production and the recruitment of high-threshold motor units. Nonetheless, concentric strength can be significantly enhanced in older persons via resistance exercise. Neural changes characterized by enhanced motor unit recruitment and coordination manifest early, whereas hypertrophy develops over the course of weeks to months. The makeup of muscle fibers changes slightly with training. Whereas type 2 fibers diminish with age, specific training can partially restore their function and size. Bone density and tendon integrity positively react to suitably administered concentric and eccentric loads, hence indirectly reducing fracture risk. Principles of training. Emphasize compound multi-joint exercises that mimic daily activities since they most effectively enhance functional performance, e.g., sit-to-stand hip hinge. Pursue increasing overload with cautious increments to mitigate damage risk. Gradual enhancements accumulate. Equilibrate strength enhancement with recuperation and flexibility exercises. Joint mobility facilitates secure ranges of motion for efficient force generation. Employ repetition ranges and intensities that foster strength and functional hypertrophy while minimizing excessive soreness that could hinder consistency. For several older folks, moderate weights with moderate repetitions are the most pragmatic approach initially. Practical exercises. Sit-to-stands chair rises, commence with assistance hands on armrests, advance to hands-free, and then to reduced seat heights or single-leg stands. Perform 2 to 4 sets of 8 to 15 repetitions. Lunges, both forward and reverse, enhance unilateral concentric strength and stability. Utilize aided regressions with rail support and decrease the range of motion if pain or instability occurs. Variations of push exercises, standard push-ups, wall or slope push-ups, and sitting presses to enhance upper body pressing strength, essential for rising from the floor and lifting objects. Deadlift variations, hip hinge kettlebell or dumbbell deadlifts, enhance hip extension, crucial for lifting and carrying while safeguarding the lower back by reinforcing correct movement patterns. Farmer's carry, loaded carry traverse with moderate loads, bags dumbbells to enhance grip core stability and concentric strength in a task-specific manner. These also develop coordination under load. For several older folks, performing 8-12 repetitions per set represents an effective balance between strength and hypertrophy. Commence with 2 sets for each exercise and advance to 3 to 4 sets as feasible. Engaging in 2 to 3 resistance exercises weekly typically fosters enhancement while permitting enough recovery. Progressive overload can be attained through augmenting repetitions or sets while preserving technique. Enhancing movement quality, deeper squat, more complete hip hinge. Diminishing support, fewer hand aids, or reduced assistance from a partner. Introduce a little external load such as a water bottle sandbag or 1 to 5 kilogram dumbbell once technique is proficient. Anticipate significant enhancements within 8 to 12 weeks, with additional progress accumulating over subsequent months and years. 3. Integrated upper body system, scapular stability and pulling strength. The integrated upper body system unifies scapular stability and pulling strength. Optimal upper limb functionality relies on the synchronized movement of the scapulae shoulder girdle back musculature and arms. The scapulae function as a dynamic base for arm movement. Their positioning and regulation are essential for effective force generation and safeguarding the shoulder joint. In contemporary lifestyles characterized by extended periods of sitting and computer usage, scapular retractors may weaken as the anterior chest muscles shorten, resulting in a forward hunched posture that undermines shoulder function and elevates the risk of injury. The practical demonstration of paddling in rafting underscored the significance of cohesive upper body pulling strength. Proficient paddling necessitates synchronized pulling power, and the ability to recover from a fall into the raft frequently relies on one's capacity to draw oneself back into the vessel. Daily life necessitates these abilities, accessing overhead shelves, operating manual equipment, transporting groceries, and lifting children or pets. A prevalent situation is an elderly individual who is capable of standing and walking, but encounters difficulties in opening a heavy door, lifting a luggage into an overhead compartment, or aiding another person to rise constraints that impact autonomy and social engagement. Aging does not inherently inhibit the attainment of substantial upper body strength. However, disuse and alterations in posture diminish scapular control and scapulothoracic rhythm. Deficiencies in the rotator cuff and posterior chain elevate the risk of injury. Training should rehabilitate scapular mechanics and enhance pulling strength throughout the posterior chain. Core stability and thoracic mobility are essential complements to shoulder exercises, as numerous upper body movements necessitate force transfer from the trunk to the arms. Principles of training: integrate scapular control exercises with multi-joint pulling actions to ensure the scapula and shoulder complex function as a cohesive unit. Improve posture by fortifying the lower and middle trapezius rhomboids and latissimus dorsi while elongating the anterior pectoral muscles to mitigate the habitual forward shoulder alignment. Incorporate both concentric and eccentric emphasis for shoulder health. Eccentric control is especially crucial for lowering after reaching or during catching duties. Advance via variations, transitioning from aided to body weight to loaded pulling while honoring pain thresholds and maintaining joint integrity. Practical exercises: scapular control exercises, wall slides, forearms positioned against the wall in a goalpost stance, sliding upward while maintaining scapular contact, scapular push-ups in plank or kneeling posture with elbows extended, maneuvering the shoulder blades prone, YTW rises to activate the lower trapezius. Exercises: banded rows using door anchors, single-arm dumbbell rows, or sitting machine rows focusing on scapular retraction. Strive for 2 to 3 sets of 8 to 15 repetitions. Face pulls: resistance band secured at chest level, drawn towards the face while externally rotating the shoulders. Highly effective for improving posture and strengthening the rotator cuff. Progressions for pull-ups: aided pull-ups using bands. Negative eccentric pull-ups jump to chin over bar and then gradually drop or inverted rows. Both partial range and isometric holds enhance capacity and confidence. Carry and transport activities: farmer's carries and luggage carries enhance grip strength and upper back endurance while mimicking the handling of real-world objects. Programming recommendation: incorporate 1 to 2 specific upper body pulling sessions weekly, or integrate pulling exercises into full-body workouts. Prioritize the quality of scapular movement rather than the number. Focus on intentional retraction and control with each repetition. For posture correction and neuromuscular re-education, engaging in regular low-load exercises several times per week is beneficial and safe. 4. Cardiovascular endurance. Prolonged capability. Cardiovascular endurance is the systemic ability to maintain extended physical exertion. It represents the cohesive functionality of the heart-lungs, blood arteries, and cellular mechanisms involved in aerobic metabolism. VO2 max, the peak rate of oxygen uptake during vigorous exercise, serves as a commonly utilized quantitative metric. VO2 max exhibits a robust correlation with functional performance and long-term health effects. Dr. Attia and other medical professionals highlight VO2 max as a reliable, quantifiable indicator of mortality. Extensive epidemiological research indicates an adverse correlation between cardiorespiratory fitness and all-cause mortality. Persons with low aerobic fitness face significantly elevated mortality risk compared to their more fit counterparts. The disparity in mortality risk between the unfit bottom quartile and the fit higher quartiles can be substantial, occasionally several times greater, contingent upon age and comorbidity. Even slight enhancements in aerobic fitness correlate with significant decreases in risk. Functional value. In addition to survival statistics, aerobic endurance is fundamental to daily capabilities and enjoyment. Activities such as lengthy walks, hiking, dancing, urban exploration, and leisure sports require an efficient cardiopulmonary system. Sufficient endurance enhances recovery from brief effort, e.g., rapid stair climbing, and promotes metabolic health, insulin sensitivity, blood pressure regulation, lipid management. Endurance also influences strength. A well-conditioned cardiovascular system enhances recovery between strength sessions and facilitates greater training volumes. The training method. Zone 2 training is an effective and sustainable means of enhancing aerobic capacity. Zone 2 refers to low to moderate intensity, steady-state exercise that maximizes fat burning and enhances mitochondrial efficiency. It pertains to an intensity at which respiration is heightened, yet dialogue remains feasible. Heuristics for Zone 2. Approximately 60–70% of the maximal heart rate, although individual variants may occur. The 180 formula age-based provides a convenient approximation, but serves merely as a heuristic. Modifications should be made based on medications and fitness level. The talk test. The ability to engage in a comfortable conversation during exercise signifies suitable intensity for Zone 2. Activities such as brisk walking, particularly on inclines, cycling, light jogging, swimming, rowing, and elliptical training are appropriate, provided the intensity remains within Zone 2. Variability in exercise modalities mitigates overuse and enhances adherence. Low-impact options are effective when joint pain restricts jogging. Advancement and coding. Initiate with sessions lasting 20–30 minutes 3 times weekly for novices. Gradually extend the duration by approximately 5 minutes weekly as tolerated until 45–60-minute sessions are habitual. Strive for 3–6 hours of Zone 2 training weekly when possible. Even 2–3 hours yields significant advantages. Integrate walking into everyday activities, commuting errands to accrue minutes. Brief, frequent sessions accumulate effectively. Augment Zone 2 with concise high-intensity workouts, e.g. intervals once or twice weekly, to enhance cardiometabolic stimulus and maintain fast twitch muscle function. Heart rate monitors are beneficial but not indispensable. The conversation test and perceived effort serve as pragmatic alternatives. Monitor advancement by enhancements in sustained pace at a consistent heart rate, extended durations without excessive exhaustion, or objective assessments such as the 6-minute walk test or submaximal treadmill evaluations. Enhancements in resting heart rate, post-exercise recovery, heart rate, and facilitation of daily activities can provide valuable insights. 5. Reactivity, agility, and fall avoidance, the emergency responders. The fifth capacity encompasses responsiveness, agility, and fall prevention attributes that ascertain whether a transient disturbance escalates into a catastrophic incident. Static balancing assessments, such as standing on one foot, provide valuable insights but are inadequate for real-world scenarios that involve unforeseen slips, accidents, and directional shifts. Preventing a fall necessitates a swift, vigorous, and synchronized neuromuscular reaction. This capability relies predominantly on fast-twitch muscle fibers, type 2 fibers, which contract swiftly and provide significant explosive force. These fibers function as the body's emergency responders summoned for immediate corrective measures. A significant and troubling facet of aging is the selective atrophy of fast-twitch muscle fibers due to inactivity. This deterioration occurs early, resulting in older persons being less capable of executing quick contractions to prevent falls. The disparity between a younger individual who trips and swiftly recuperates and an older individual who stumbles and falls frequently can often be attributed to reduced fast-twitch muscle capacity and the brain pathways that activate them. Cognitive processing speed and reaction time drop modestly with age, indicating that the nervous system may be slower to identify and rectify disruptions. Training principles. To enhance reactivity, training must cultivate power, multidirectional strength, and proprioceptive precision. Power training prioritizes the velocity of contraction, e.g., lighter weights executed swiftly over maximal big loads which are less pertinent to rapid corrective maneuvers. Multidirectional drills enhance ability in the frontal and transverse planes through sidestepping, backward stepping, and rotational responses as numerous falls arise from lateral movements or off-axis disturbances. Proprioceptive training subjects the nervous system to variability and disturbances, enhancing reflexive reactions and adaptability to unforeseen surfaces or forces. The integration of cognitive challenges dual tasking enhances real-world responses during split attention scenarios, such as walking while engaging in conversation. Practical exercises. Low-impact plyometrics, brief rapid hops, emphasizing little ground contact duration, advancing to lateral and forward-backward hops as proficiency improves. Commence with 2-foot hops in situ, then advance to single-leg hops with caution. Medicine ball or weighted object power drills overhead smashes circular throws or chest passes executed explosively with mild to moderate resistance to develop coordinated whole-body power. Lateral lunges and banded lateral walks enhance frontal plane strength and hip abductor functionality, essential for lateral movement and pelvic stabilization. Reactive step training, executing rapid corrective steps in reaction to verbal or physical disturbances conducted in a secure, supervised setting. Examples include the partner pull test, a gentle, quick tug, eliciting a rapid step or randomized signals instigating directed steps. Surface variety ambulation, traversing grass, gravel, sand, or irregular terrains to activate foot and ankle stabilizers and enhance sensory feedback. Commence on moderately irregular terrains prior to advancement. Balance and cognitive dual tasking. Incorporate tasks that merge balance with an additional cognitive difficulty, e.g., counting backward while standing on one leg, thereby more accurately simulating real-world scenarios when attention is divided. These activities enhance resilience in actual situations and more effectively mitigate fall risk compared to isolated balancing exercises. Advancement and safety. Initiate cautiously with activities that present minimal fall risk, e.g., hand-supported hops or medicine ball smashes in a stable position. The rate of advancement and intricacy as the participant exhibits mastery. Utilize support such as bars or a therapist for more sophisticated perturbation exercises. Establish a secure setting, unobstructed floor, non-slip surface, and contemplate supervision for more demanding drills. Evaluation oversight and operational objectives. Utilize straightforward functional tests to facilitate training and monitor progress in clinical or home environments. Timed up and go. Tug stand from a chair, traverse 3 meters, pivot return, and sit down. Times exceeding 12-15 seconds frequently signify a danger of falls and diminished mobility. Enhancements of 2 to 3 seconds are clinically significant. The 30-second sit-to-stand test measures the number of rises completed in 30 seconds. Low counts indicate diminished lower body strength and endurance. Monitoring weekly alterations can indicate advancement. Single-leg stance duration of maintaining balance on one leg. Less than 5 to 10 seconds may suggest balance impairments. Strive for gradual enhancements and balance between sides. The 6-minute walk test, 6MWT, assesses sub-maximal aerobic capacity and functional endurance with the distance covered reflecting daily activity tolerance. Stair climb or step tests simulate typical environmental challenges and assess deficiencies in concentric and eccentric strength. Grip strength is associated with total strength and functional results, serving as a straightforward indicator of global muscle condition. Utilize baseline values to establish pragmatic, gradual objectives. Minor regular enhancements, e.g., incorporating one sit-to-stand exercise weekly or extending Zone 2 time by 5 minutes, accumulate into significant advancements over months and years. Regular re-evaluation every 6 to 12 weeks aids in optimizing programming and sustaining motivation. Template for a scalable weekly program. This is a demonstrative template that equilibrates the 5 pillars. Tailor to health condition time constraints and recuperation needs. Sessions may be amalgamated or divided. Advancement need to be incremental. 2 sample alternatives are presented: a concise time-efficient choice and a comprehensive weekly template for individuals with greater availability. Optimal time-efficient solution for busy adults. Strength training with an emphasis on eccentric movements, 2 sessions per week, 30-40 minutes each. Warm-up, 5 minutes of brisk walking followed by dynamic mobility exercises. Tempo squats or sit-to-stands, 2-3 sets of 6-10 repetitions, 3-5 seconds for the lowering phase. Lunges or step-ups, 2 sets of 8 to 10 repetitions per leg. Banded row or single arm row, 2 to 3 sets of 10 to 12 repetitions. Farmer carry, 2 sets of 30 to 60 seconds. Brief power, 2 sets of 6 tiny hops or 6 medicine ball chest passes. Zone 2 walking 20-30 minutes on non-strength training days, 3 to 4 times per week. Daily micro-practices maintain single-leg balance for a cumulative duration of 60-120 seconds. Engage in stand-to-sit exercises whenever feasible. Comprehensive weekly template for individuals with additional time. Strength training sessions, 2 to 3 per week. Full body emphasis, warm-up, 5 to 10 minutes of mobility exercises and light aerobic activity, walking, cycling, eccentric-focused exercises, tempo squats or step-downs, 2 to 3 sets of 6-10 repetitions, 3 to 5 seconds lowering. Concentric-focused exercises, sit-to-stand lunges. Or deadlift variations, 2 to 4 sets of 8-12 repetitions. Upper body integration, rowing, pulling progressions, and pushing variations, 2 to 3 sets of 8-15 repetitions. Accessory, core carries, trunk stability, 1 to 2 sets of 20-60 seconds. Cool down, gentle stretching and respiration exercises. Zone 2, endurance, 1 to 3 sessions per week. 30 to 60 minutes of brisk walking, riding, or rowing at a conversational intensity. Commence with a period of 20 to 30 minutes and incrementally extend the time. Power reactivity sessions, 1 to 2 brief sessions weekly, 15-30 minutes. Low-impact plyometrics, 3 to 4 sets of 6-10 minor hops or low-box steps. Medicine ball smashes or throws, 3 to 5 sets of 6-10 explosive repetitions. Lateral lunges, banded lateral walks, 2 to 3 sets of 8 to 12 repetitions per side. Proprioceptive challenge, single-leg balance with eyes open, advancing to eyes closed for brief durations. Daily micro-practices integrated into routine steps. Single-leg stands during toothbrushing, light carry. Implementation guidelines and safety considerations. Warm-up, engage, and gently stimulate certain muscles prior to high-intensity or eccentric loading. Warm muscles exhibit enhanced tolerance to eccentric stress and forceful movements. Movement quality. Emphasize technique and pain-free range prior to increasing load. If an exercise induces joint pain, acute or chronic, reduce intensity and seek professional advice. Distinction between pain and soreness. Delayed onset muscular soreness. DOMS sometimes occurs when initiating new eccentric or power training, but should diminish with adaptation. Chronic joint pain or acute pain is an indicator necessitating intervention. Frequency and recuperation. Older persons may necessitate extended recovery periods between vigorous sessions due to diminished recovery kinetics. Track sleep energy levels, mood, and daily performance. If tiredness builds, decrease volume or intensity. Progression. Gradually augment load. 5 to 10% increments, or enhance volume through additional repetitions or sets. Permit many weeks at a specific level before advancing to facilitate adaptation consolidation. Medical clearance individuals with unstable cardiovascular diseases, uncontrolled hypertension, recent myocardial infarction, uncontrolled arrhythmias, or other urgent medical concerns must obtain medical clearance prior to commencing higher intensity or resistance training. Expert assistance, engage with physical therapists, strength coaches, or exercise specialists, particularly during injury rehabilitation, post-surgery recovery, or when intricate movement retraining is required. Clinicians can customize regimens for joint replacements, pain syndromes, or neurological problems. Supplementary resources that facilitate training and adaptation. Nutrition. Sufficient protein consumption facilitates muscle repair and hypertrophy. Older persons typically require 1.0–1.2 g/kg per day or more, tailored with a nutritionist, with protein evenly distributed across meals and a higher protein post-exercise snack when suitable. Caloric adequacy, micronutrient sufficiency, and timing in relation to training can all affect increases. Vitamin D and calcium are essential for skeletal integrity and muscular function. Rectify deficits under medical supervision. Vitamin D adequacy also facilitates neuromuscular function and equilibrium. Sleep facilitates recuperation and neuromuscular adaptation. Strive for consistent sleep duration and quality. Inadequate sleep diminishes training outcomes. Footwear and environment. Durable shoes with excellent grip diminish the danger of slipping. Maintaining unobstructed pathways, sufficient illumination, and mitigating environmental risks at home lower the likelihood of falls during movement practice. Assistive devices utilized briefly to facilitate safe practice during capacity development, e.g., handrails, walkers aiming to diminish dependence as functionality enhances. Devices must be utilized and adjusted according to guidance to prevent compensatory movement patterns that hinder strength development. Behavioral tactics to enhance compliance. Initiate with modest and continuous efforts. Little daily or tri-weekly habits foster sustainable advancement. Consistent routines surpass intensity for sustained adherence. Ensure activities are purposeful. Select actions that facilitate cherished pursuits. Gardening, walking with grandchildren, traveling. When training is directly aligned with purpose, compliance enhances. Sequence objectives enhance one pillar sequentially, e.g., commence with eccentric control and zone 2 walking prior to including intricate power drills. Initial successes foster confidence. Monitor advancement records of sit-to-stand repetitions. Walking duration or elevated step heights bolster motivation. Constructive feedback fosters motivation. Social support. Participate in group classes, engage in walks with friends, or exercise with family for inspiration and safety. A training buddy can enhance accountability and enjoyment. Flexibility and leniency. Life events disrupt routines. Devise realistic return-to-training strategies instead of adopting an all-or-nothing mentality. Prevalent fallacies and elucidations. Heavy lifting poses risks for older adults. Appropriately designed resistance training is safe and advantageous. Substantial relative loads may be employed cautiously, but are not essential for attaining significant functional improvements. Concentrate on technique, incremental loads, and supervision as necessary. Balance training alone is inadequate for fall prevention. While static balance is crucial, it is insufficient. Effective fall prevention necessitates strength, reactive power, eccentric control, and cognitive training. Integrate modalities for optimal efficacy. Cardio exclusively or weights exclusively. Neither method alone is adequate. Cardiovascular conditioning strength, both eccentric and concentric upper body integration and reactivity training are interdependent and synergistic. If I am healthy, I do not require resistance training. Even physically active older persons gain advantages from specific resistance and power exercises to sustain structural integrity, bone density, and fast twitch capacity that typical activities may not adequately protect. Strategies for prioritization under time constraints. When time or energy is constrained, select interventions that yield the greatest anticipated benefit for everyday functioning. Sit to stands, concentric and step downs. Eccentric, replicate the needs of stairs and chairs, demonstrating significant time efficiency. A consistent 30-minute Zone 2 walk enhances endurance with no danger and is easily incorporated into one's schedule. Short power training, 5 to 10 minutes of tiny hops or medicine ball tosses, conducted bi-weekly, maintain fast twitch capacity. Cumulative daily exercise of single-leg balancing for 1 to 2 minutes enhances proprioception and addresses asymmetrical impairments. These priorities fulfill most daily functional requirements with minimal time commitment. Assessing significant results, monitor results that pertain directly to autonomy, capability to ascend a staircase without pausing, autonomy in activities of daily living, dressing, bathing, transferring, capability to ascend from the ground unaided, incidence of falls or near falls, length of time and distance of continuous walking, capability to transport and handle typical loads, grocery bags, laundry basket securely. Enhancements in these domains are more pertinent to quality of life than singular gym measurements like 1 repetition maximums. When such functional improvements are recorded, they directly result in maintained autonomy. The cumulative impact, a tangible 401k. The analogy of a physical 401k encapsulates the core of this philosophy. Each intentional practice session constitutes an investment in future resilience. Regular contributions of mobility, strength, and endurance accumulate throughout the years. The reserve established by unconventional control, concentric strength, coordinated upper body function, aerobic endurance, and reactive agility provides a resource that can be utilized when faced with challenging circumstances or incidents in an aging body. This procedure does not require a complete overhaul. Rather, incremental durable modifications that prioritize consistency and gradual adaptation yield the most dependable long-term advantages. Similar to financial investments, the earlier and more consistently contributions are made, the greater the accumulated reserve and the lesser the danger that a singular unfavorable event will trigger a catastrophic decrease. Conclusive viewpoint, recontextualizing aging. The primary aim is to transform the anticipated experience of aging. This method reframes aging not as an inevitable decline in function, but as a phase where deliberate training can sustain and improve the capacity to participate in meaningful activities, uphold independence, and contribute to familial and communal life. Developing a robust, disciplined, well-conditioned, and responsive physique enhances the probability that the later years will be defined not by constraints, but by ongoing autonomy and engagement. The decisions about one's actions today constitute the practical and lasting foundation upon which the freedom and potential of future selves will rely. Checklist for takeaway. Practical initiation. Evaluate baseline. Do a timed up-and-go test, a 30-second sit-to-stand assessment, and a 6-minute walking test. Select a single pillar to initiate, for instance, eccentric control through tempo squats and step-downs. Incorporate a Zone 2 walk lasting 20 to 30 minutes 3 times a week. Incorporate 1 upper body pulling exercise, band row or face pull, and 1 pushing exercise in each strength session. Integrate 5 to 10 minutes of power and reactivity drills bi-weekly. Advance gradually emphasize the quality of movement and consult a specialist for pain or medical intricacies. By concentrating training on these 5 interconnected capacities, individuals can significantly alter the equilibrium of risk and resilience as they age, maintaining the autonomy and quality of life necessary for engagement in meaningful activities during the marginal decade and beyond. Every day you choose to move, your body responds with strength, balance, and renewed life. Each gentle motion is a gift to yourself, calm, mindful, and full of vitality. Together we move, we heal, and we thrive. Keep the rhythm of your golden years, nurture health, cherish every movement.